Good morning. I'm Dr. Joe from Boca, and I'm wondering how I can be of help to you today. I had the pleasure of being a guest caller on a radio show this morning, and the subject of the call was teenagers and plastic surgery. There is an absolute epidemic of the number of cases of teenagers in our country receiving plastic surgery, so I thought I would take a minute and share a few quick thoughts. The bottom line is, I am a very strong proponent in favor of teenagers and plastic surgery, but only if a specific criteria or there is a specific goal for the surgery. Now, contrary to most folks who think about plastic surgery, we usually think about getting a procedure to enhance our looks in order to call more attention to ourselves. Breast augmentation coming to many people's minds. For teenagers, I have a different opinion. I believe that the only children or teenagers who should be receiving plastic surgery are those who need the surgery in order to have less attention, not more attention, but less attention called to themselves. In other words, if the size and shape of a child's nose or his or her ears, or in some cases for young girls or teenagers whose breasts are so large that they end up being the cause of ridicule, if they're picked on by their peers, etc., then these children and teenagers are in fact a candidate for plastic surgery. On the other hand, the notion of teenage women receiving breast implants and other procedures to enhance their breasts in order to become more sexualized and cause people to look at them more, I'm absolutely against it. So if you have a teenager and he or she is asking for plastic surgery, ask yourself this question. Is the goal to help the child receive less attention? And by that it's usually negative attention or more attention. Of course, no child should undergo any kind of surgery like this without some sort of counseling along the way. So I'm Dr. Joe from Boca. I hope this is helpful, and I look forward to speaking with you again soon.